So, the first topic today that I would like to discuss is going to be intertwined with the other two. I have three topics that I'm going to divide into segments. Um, some people would see this as a rather dark topic, but it's a necessary topic. And uh, the thing I want to focus on in the first session is of suicide. Then I want to move into the second session with how physicians are impacted. And the third thing is to talk about some wellness in the form of social connectedness, which would be a preventive measure for suicide. So let's talk a little bit about suicide in general. We now have a fabulous system in our country, the 988 number. It's been very successful. People can reach out to that number, talk to a trained person to address suicidal thoughts, whatever's going on in your life. Um, uh, Naturally, if they feel that the person they're on the phone with is at acute risk, they are going to notify authorities and intervene. But for the most part, just an avenue for people to talk about their experience, what they're going through, and as a resource. So um, it's a very well used. I think the last thing I read was like they're up to like 80 some percent of their call volume. So people are really reaching out to use the service. I want to talk a little bit about some of the statistics, current or most recent. I got these particular statistics from the CDC, and they're from 2021. So in that year, there were 48,183 deaths by suicide in the United States. That equates to one death by suicide every 11 minutes. When you break it down to those, you get the feel for how much this impacts people's lives. So this particular set of studies showed that 12.3 million adults in 2021 seriously thought of suicide. Staggering number. 3.5 million adults made a plan, and 1.7 million people in our country attempted suicide. So in 2021, there was an uptake after there had been declines in both the years of 2019 and 2020. Further, it shows that suicide is the 13th leading cause of death among vets. It's the second leading cause of death among veterans under age 45. So we're talking about a younger subset of that population. Firearms were used in approximately 55% of suicides. So that lets us know the impact of firearm availability, protective factors perhaps we should consider. There were more suicides among the age group 25 to 64 than the other age groups. So, those give us some kind of factors to consider as medical providers when we're seeing our patients is, do any of our patients fit into these categories? And we need to look down further with some of the drivers of suicidal behavior. Naturally, we know depression is a primary. Other things among students include academic concerns that they might have, relationship concerns, physical health is a factor. Mental health and well-being is the factor. Also, economic standing, financial concerns. And another driver that we begun to focus more concern on is that of workplace stress. Therefore, wellness at TJ. So I read one study or one article from the American Medical Association that identified that for physicians, one of the major stressors is managing inbox and messaging. I know that to be true based on who I've seen here. The burnout among physicians in 2021 was rated at 63% versus 38% in 2020. Now we know we had COVID there and we know the impact of that, but you got to think about what are the other risk factors. So we know some of the risk factors involved in suicide are relationship driven, conflictual relationships, violent relationships, bullying, especially among children and teens, and also among adults, relationship loss, and social isolation. One of the societal issues, I think, for physicians is basically, and for other people, but I wonder if it's not more so for physicians and even mental health providers and people in the helping professions, is the stigma associated with getting mental health treatment. I think particularly physicians and mental health providers, there's that sense of I have to be perfect. I have to do things perfectly. I cannot be vulnerable. I cannot let people know that I'm vulnerable. So I think those are some of the risk factors that as physicians and medical providers, I think we all need to be aware of. So I want basically for this session, just think about the the prevalence of suicide, the prevalence of suicidal thoughts, the presence of suicidal attempts, and the risk factors.